will more than welcome to join in on. Thank you.
Again, thanks to all of you gentlemen. We appreciate it very much. Thank you, Mr. Chair.
Senator Baldwin and then Senator Capito.
Thank you, Mr. Chairman. Lieutenant General Harder, we have had thousands of active duty and reserve soldiers participate in combat operations against Iran over the last several weeks, and 13 U.S. service members have been killed. Hundreds more have been injured since the war began. So I would like you to please identify and explain any differences between how soldiers in the active duty and reserve components are screened for injuries and given medical care as they return from combat deployments like those in the Middle East.
Thank you, Senator Baldwin, for that question. Good talking to you last week. So I think when it comes to our soldiers on the battlefield, we're treated as one team. We're treated, by the way, phenomenal treatment, what I'm getting anecdotally from our wounded that came back, also by Kuwait medical care, and then going up through Landstuhl, and then getting back here to the United States. 2 quick points I would offer is it's bringing the family members into that process quicker. I think some of our skill sets have atrophied on how we notify families of wounded soldiers. Obviously, our fallen, we're pretty good at. So making sure family members are tracking the status of their soldier. And then once we get back to our mobilization site, my biggest concern is as soldiers are screened, they've been in a pretty kinetic environment, and then they go back to home station. And so how do we maintain contact and make sure those soldiers continue to get the care they need? And we're nested with the medical community, our soldier recovery units, SRUs, to continue to maintain that. And then, ma'am, it's just leadership, making sure squad leaders, platoon leaders, and commanders at echelon are tracking by name.
Thank you, General. I've heard directly from some Army reservists from Wisconsin who returned from the war and said that they initially received less timely and thorough medical services than their active duty counterparts. Has the Army reviewed the care reservists are receiving after deploying in the war against Iran? And have you identified any problems?
So, ma'am, we are reviewing, as is the Army, exactly what care our soldiers receive. We've met with some soldiers as they've come back through Fort Hood and back through Washington, D.C. here, and there were some perceptions, I believe, and perceptions are pretty important, that they weren't receiving the same level of attention. We think they have, and but we will continue to follow up to make sure that they get the care they need. I'm flying to Fort Hood in the not so distant future to talk to some more of our young men and women.
Thank you. My next question is for you, General Nordhaus. Given that members of the National Guard do not receive full and premium-free TRICARE benefits like their active duty counterparts, Guardsmen can struggle to pay for medical care necessary to keep themselves ready for combat. Can you describe some of the medical readiness challenges that are faced by the National Guard and how that impacts your ability to deploy?
Senator Baldwin, thanks for the question. All of our National Guardsmen, all 435,000, they're ready to go. Always ready, always there, means something. And so as we look at their medical care, as traditional soldiers and airmen, they don't get, that full-time TRICARE. And so what we see is that probably the largest section of readiness comes on the dental health. Mm-hmm. And so when we send soldiers to an MFGI MOB station, they don't return or get returned to unit because they're not ready or they're not trained. It's because they're not dental ready, right? And so dental readiness is readiness for our National Guard, and so I think that's very critical. As we look across all of our healthcare, look forward to working with Congress on incremental approaches to this so that all of our members can have the healthcare they need to be always ready and always there.
Thank you. Given how much our military relies on our Guardsmen and reservists for operations, it seems clear that we need to take further action to get the reserve component better access to health insurance and health care. What can Congress do to help? And do you think it would improve readiness to expand TRICARE access, including dental, to the reserve component?
Any health care is great for the National Guard. We look forward to working with Congress, but I'd also like to open it up to the other reserve chiefs.
Yes, ma'am. Absolutely. TRICARE Reserve Select right now as an option was recommended in 2020, but is not scheduled to put in action until 2030. Anything we can do for our reserve technicians decreases an individual's cost per month of about $216, decreases a family member's about $350 as they're currently paying through the FEHB. In addition to that, dental. There's a $1,500 cap on an individual in terms of what they're authorized when they're not in an order status. So put one root canal on the books and you're not qualified to deploy. During a normal deployment cycle, 180 days ahead of a rotation deployment, they've got the opportunity to get on orders and get that fixed. But in this last execution of Epic Fury, we mobilized our people in 72 hours. And there's no chance that we're going to get those people needing that additional care, that level of care for that cost benefit.
Thank you.
Senator Capito, followed by Senator Shaheen.
Thank you, Mr. Chairman. Thank all of you for your service and for being here. Before I begin my question, I wanted to acknowledge a tragedy within the Guard community, obviously, and I do express my condolences to those who have had issues with this latest incursion, but we lost 2 Guard members from the West Virginia National Guard community the day before Thanksgiving. Specialist Sarah Backstrom and Staff Sergeant Andy Wolf, who was 24, were attacked here in Washington, D.C., while volunteering to make our streets safe. We lost Sarah on Thanksgiving Day, and we continue to send prayers to her family in West Virginia. I'm proud to report that Andy has made a miraculous recovery, not full, but miraculous, so far, and he threw out the first pitch at the WVU baseball game just recently. So it's a testament, I think, to the service and sacrifice of our National Guard members, and I just want you all to keep them in their thoughts and their families and their thoughts and prayers. And General Nordhaus, thank you for everything that you've done. Admiral Lufgren, it's great to see you again. Thank you for coming to your visit to West Virginia to see the Lockheed Martin facility that makes significant portions of not just the Navy's KC-130J, but also this C-130 variants across all the other services. Now, we've already kind of covered ground here on the 130J, but I just wanted to give you an opportunity to talk about the significance of that aircraft for the Navy Reserve.
Senator, I appreciate the question, and thank you for the time in West Virginia. The KC-130J, as I look at it, it's not just another aircraft for the Navy. Really, it's the connected